together that we're able to focus on. And it's the collaborative infrastructure that allows us to really get this stuff right, whether it's dealing with unique challenges or whether it's growing together on the things that we're really thriving in. So anyway, that felt like a good one to really kind of double down on today. I think we can go ahead to the next slide. Here's our objectives, agenda, and housekeeping slide that we go over each time. Our objectives today is we're going to continue to reflect on the work to date, envision next steps to enhance school-linked behavioral health services. We're going to empower community voices, and you'll see in just a minute when we get over to the agenda side of this slide. We've got some really great community voices today that we're really excited to hear from three different county offices, particularly. We want to engage in activities to foster collaboration and learning and provide insight on technical assistance and ways to support administration of the capacity grants. So our agenda today, here we are in the welcome. I'm going to turn it over to a new team member here in just a minute for the inclusive welcome. But really want to point out and just thank Mariposa County Office of Education. We've got Bethany Hartford is joining us today, and Mariposa is going to be focusing on this theme of building family and community trust. Mariposa, thank you. I've had a chance to preview your slides. I can't wait to hear the work that's going on and what you're about to share. We've got Riverside joining us as well. They're going to be kind of digging into that idea of universal supports tier one work that's happening in their county. And we've got Teresa Stevens, Denise Granger, and Angelica Placencia is joining us from Riverside around the universal supports. Thank you, Riverside. Can't wait to hear from you all as well. And then we'll have, I think, a little bit of a break. And then we'll hear from Yolo, and they're going to really dig into this idea of youth voice and culturally affirming practices. And that's, please correct me on your name, but Najwa Burdick Yaha, or Yaya, I think is the, how do you pronounce your last name? But please correct me now or as you come on a little bit later.
Perfect.
So a couple housekeeping items. We said this earlier, but if you get a chance, please update your name just to add your county office or organization, if not a county office, next to your name. And then just a reminder that we are recording. I'm going to turn it over to a new team member at SCOE in just a moment. Her name is Christina Mennel, and she has the role of youth fellow. And maybe this is one that Yolo will probably be digging into some of this as well. But we've got a new priority at SCOE to hire youth into our programs to give us feedback, provide voice, advocate for the things that young people really think need to be happening across programs at SCOE. And we have a youth fellow that's leaning in to support both our statewide mental health team, our capacity building grant team here at SCOE, and also leaning in and supporting what's going on locally around mental health. And Christina's just being onboarded, but we're really excited because one of her first tasks is to lead us in an inclusive welcome that she's going to be doing in just a moment. But anyway, just wanted to highlight and kind of brag on Christina. She's from Stockton. She joins many others on our team as a big K-pop lover. I think she is part of a K-pop club, maybe even at Sac State, if I've got that right. But we're really excited to have her on board and also excited to have her leading our inclusive welcome. I think that's where my responsibility rests in terms of the slides here today and getting us started. So let me get this over to Christina to lead us in a warm welcome. Christina, welcome and thank you.
Thank you so much, Brent. That was a very large introduction. I feel so important.
You are
But
important.
yeah, oh, thank you. So yes, hello everyone. My name is Christina. I'm the youth fellow at Sac County of Education, and I'm excited to bring you the inclusive welcome for today. Our inclusive welcomes are an opportunity to model practices that create connection and belonging that we can bring into our own meetings, teams, and communities. And today we're inviting you to take a moment and reflect on the past year. So you can see the prompt on the screen, and then we will also have it in the chat, and then we'll put you into breakout rooms for about 4 to 5 minutes, so that way you can talk amongst each other and reflect. So yes, here it is. Looking back on the past year, what is one accomplishment from this year that you're most proud of? And what is one hope you have for the future of school-linked behavioral health? All right, so yeah, we'll go ahead and put you in your breakout rooms and have fun. All right. Thank you, everyone, for participating in the inclusive welcome. Would anyone like to come off mute and share, drop a reflection, or share off mute or drop a reflection in the chat? Please feel free to do so. Okay. I suppose now I will. Oh, Caressa, our room had reimbursement checks coming in. Yay! Congrats. Yeah, okay, I suppose I will pass the mic to Patrick. Thank you again for participating in the inclusive welcome.
And thank you so much, Christina, for leading that amazing inclusive welcome. It's so good to take a second to reflect on the past school year. I know this time of year for me is always a really important time to slow down and think through all of what's happened and how to make success occur in the next school year. Great. Next slide, please. Okay, so we're so excited for our first spotlight for today. We have Bethany Hartford from Mariposa County Office of Education. Could not be more excited for this presentation. Bethany and I have been meeting to kind of prep for this presentation around theme one of building family and community trust. And she's been doing a phenomenal job, really in Mariposa County, really trying to make sure that they're intentionally building relationships, going slow to go far, like really making sure that they are thinking through how do they help folks in their community really trust the fee schedule work and trust all of school-based mental health work that they're engaging in. One of the things that I've really enjoyed about meeting with Bethany too is I really feel like, Bethany, you do an amazing job moving at the speed of relationships. Like I feel that in our meetings, I feel that when we meet and talk, and I just really truly feel like you must be doing a phenomenal job at Mariposa doing this really important piece of the work. So can't wait for you to share more, and I will hand it off to you, Bethany.
Thanks so much, Patrick. Those kind words, I appreciate that. And thank you, sorry, thank you so much for the opportunity to share our experience with building trust and with families and communities here in Mariposa. And when you're ready, you can pull the slides up. And you can go ahead to the next slide. Just a little bit about me briefly. I came to Mariposa County about 25 years ago when I worked for the National Park Service in Yosemite, and then stayed here to raise my kids. So I've been here a while. Came to teaching as a second career about 5 years ago, and moved into this role as the coordinator for CYBHI last year to get us up and running as part of cohort 4. Next slide. A little context about Mariposa County. We are a small rural single district county. We have about 17,000 residents in the entire county and 1,800 students. We have about 8 school sites with 1 independent charter school as well. And our district includes a small school up in Yosemite Valley. We're very spread out by mountain roads, and the distance between schools is quite great. So a lot of the students you'll see in the North County, like the Greeley, Coulterville, or Yosemite Valley kids, once they hit high school, they're traveling an hour and a half each way on buses to get to school. Our providers who serve the various schools spend a good deal of their day traveling to get to these sites. We have about a 70% socioeconomically disadvantaged population, 4.7% English learners. As with many small rural counties, behavioral health services and infrastructure are limited, so the schools are really an access point for those services. And then that being said, like many small communities, we also have the very strong community identity. Relationships in the community are very important and long-standing, and the schools are really central to those relationships. Next slide. So the schools in small towns, right, really are more than just educational institutions. They local sports teams and activities are very much a part of the community. The spaces at schools can serve other purposes, like for elections or emergency shelters. Social events are very visible in the community and strengthen community bonds. We're one of the largest employers in the county, so there's that link to the community as well. And because of all those things, when families really feel connected to the school system and you have those long-standing relationships, they tend to engage more with the schools, so that when we initiate a program like CYBHI as a new program, if you've built that relational trust and that relational capital, they'll tend to participate more in a new initiative. Next slide. Trust can also be very magnified in a rural community. There's sort of the living in a fishbowl effect. I can guarantee you that when I go to a grocery store in town, you know, I'm going to run into somebody I know every single time. It's going to be a student or a parent or staff member, right? So relationships are really highly visible, and things that are said and done in the community are very visible to those people in the community. There's a multi-generational reputation. We have grandparents who went to schools in Mariposa County. Their kids then went to school in Mariposa County, and now their grandkids are attending school here. So the perceptions of schools kind of follow the generation. So whether it's positive or negative, it continues down through the generations, those reputations. There's also the grapevine in a small community. So informal information and rumors can spread very quickly. If something happens at a school site, it's going to be posted on the Facebook page, chat group very quickly, and people are going to start talking about it, right? So if you've built that relational capital and you have, if families and the community have a positive view, that's going to kind of shape the narrative that's happening. So it takes a while to build trust, of course, right? It's built very slowly. You have to be consistent, open communications, reliable systems, trusted staff are all very important. And it can also be lost very quickly. So it takes time to build, but we can also lose trust pretty quickly. Next slide. So when Patrick first asked if I'd be interested in presenting about what we were doing to build trust related to CYBHI, I was thinking back and how really the building of the foundation for trust happened before I came on board, before we even started thinking about implementing the fee schedule program. One key aspect of that was the creation of our Student Support Services Department, which happened in the 2023-24 school year. So it basically brought together this group of really dedicated staff members who were there to support the mental health and well-being of our students. So it created sort of this cohesive group. It made us more visible to families and more collaborative. You can see there some of the team includes like the community schools coordinator, foster youth, peer-to-peer coordinators, clinicians. So just a whole team that is there to support our students, which was really helpful in starting to build this foundation. Next slide. So within Student Support Services is our community schools coordinator, and we started the community schools model in 24-25, so last school year. And that, I think, really also played a big part in preparing us to launch the fee schedule program, really built that relational capital and reduced some barriers by engaging with families and communities starting the previous school year. So they really worked hard to increase engagement with things like parent workshops, the creation of a family resource page, which has an amazing number of resources for our families, monthly newsletters being sent out, and then really collaborating with our partners in town for various events, whether it was inviting them to events that we were holding or us participating in their events. Next slide. And so we started to see some results of those efforts to build those relationships with the family and the community. Just a couple examples here. We've increased our community partner engagements. Last year, there were about 56 site events to over 70 this year. Probably increased a little bit towards the end of the year as we held our open houses and things and had invited partners to those events. Family participation, the check survey responses tripled. Last year, we had around 200 families participate in the survey to over 630 this year. So that was really exciting to see that increase. And then we were also finding that the dual impact connections, that when we go and participate in community events or those community partners come to us, many of those community partners are also parents and family members of our schools. So we have that double impact and that strengthening of the connection between our community partners. Next slide. And so before we even started reaching out to family and community as we were going to implement the program, we really thought a lot about internal trust as well, and the fact that we needed staff to be on board with the program, right? So if we really wanted to focus on providing staff with, a clear picture of what this was all about, provide them with the training they needed, make sure admin was backing the program at the various sites so that we could build up that staff confidence. And then once, of course, you have the staff confidence, then they can more easily relay information about the program to our families. If the families feel like they have confidence in the staff and system, then they're more likely to engage and increase participation in the program, and then ultimately increase our claims and reimbursements. Next slide. So then finally, in last August, when we were ready to launch the program, we started off before school even started by putting an article into the local paper. I know in many places newspapers are dying out, they say, but in our small community, it is definitely still very much a trusted source of information, and people look forward to getting the paper every week. They go to the education section and can read what's happening in the schools. So we placed an article in the paper to talk about why we'd be asking for insurance information, what the program was all about, the purpose of supporting our students' mental health. So that happened before school started. Then we sent out parent square messaging, English and Spanish versions, flyers. We attended all the back to school events. Every site holds one before school starts. So we had tables at those events to explain the program, and participated in a lot of community events where we could get the word out. And I will say that all of the articles, flyers, and all of that are also very, very important, but found that the one-on-one family conversations were also pretty critical when we were able to stand there and answer questions, because the program still can be confusing to people when they first learn about it. So to be able to talk to them was very helpful. And just adding, there's been many times throughout the year where I think, oh gosh, if I had a clinical background, it would be so helpful in implementing this program. But I think this was one case where coming into it as a teacher was very helpful, because I could be at these events and talk to the families who knew me and trusted me, and that was really helpful. Next slide. And I know I'm getting close to time, I'm almost there. Just some successes for the program. We were very happy when we first launched in our student information system, ARIES. We did initially get 80% consent to bill and 70% of families providing insurance information. However, and I know some of you have heard this before, but the consent to bill, the form that they needed to read, didn't actually pop up. So they clicked yes to the little blurb, but we didn't feel like we could, that it wouldn't be best to count that, so to speak. So when we had to end up sending paper consents home as well. So when we filtered it down with proper consents to bill, completed insurance information, because out of that 70%, it wasn't always necessarily complete, we had about 13% of our students that we could bill for this year, which we feel like was a great start. And that number's a little off as of today. I think we have about $55,000 in claims generated, and just still a little over 14,000 that we've been reimbursed. Next slide. So looking ahead as we move forward to continue with the Family and Community Trust, just continuing to strengthen the partnerships that we've already built. We put another article in the paper just about a month or so ago based off of the capacity grant memo about insurance collections. We kind of adapted that and placed that in the paper again to let folks know, what was happening this year and that we're still the success of the program and in supporting our students. And we'll plan to put another one in the paper in August before we start back to school. And then you can see here, and I think there's links embedded here, but all of our consent forms we've updated. We're trying to make the messaging a little more consistent. Previously, all the school sites had their own separate consent forms and everything looked a little wonky. So we were trying to make things a little more professional and get some branding for our flyers and so forth as we move forward. And next slide. So just to wrap it up, key takeaways with really that trust building for us began well before implementing the program, kind of a long process of taking our time and being consistent about our messaging and what we're doing and building those relationships. Community schools was a really important part of it. Internal trust, and that's an area we found that we did pretty well with internal trust with our providers and providing them with training and getting them on board. But an area to work on will probably be internal trust with other staff members that we found were denying consent to bill this year. So we need to kind of reach out a little more to some of our teachers and other staff members to keep working on building that internal trust. And then, yeah, just if I had to pick one keyword, I would just say relationships. It's all about relationships and folks trusting in who we are. There's a lot of distrust in small communities, distrust of institutions. And so the more you can really build that foundation and have good relationships with your families and your community is really helpful for implementing the program. And with that, I will pass it back to Patrick.
Yay! Thank you so much, Bethany.
You're very
Woo!
welcome.
I hope you were seeing all of the amazing emojis in the chat. Look at all the applause and the hearts. Truly phenomenal presentation, and you're doing really transformative work in your county, and so just inspiring to hear about all of it. Thank you so much for sharing, Bethany.
Thank you.
Yeah. All right, next slide, please. Great. So we're going to give folks some time to go back into breakout rooms. So it'll be the same breakout room that you were in previously for the inclusive welcome to have a chance to reflect on Mariposa's presentation and then also reflect within your local context. How are you building trust with families and communities, and what challenges continue to exist that maybe you're going to think about going into the next school year? So let's go ahead and open up those breakout rooms. Welcome back, everyone. Welcome back. Great. I hope everyone had wonderful conversations in your breakout room. It was so great in our breakout room to connect around this topic. What a joy to dig into and to hear some of the successes and challenges over the past year. I will go ahead and pass it to Carissa for our next spotlight.
Thank you, Patrick. Next slide, please. So our second spotlight focuses on universal supports and Tier 1 systems. As many of you know, this remains a strong area of interest in our community of practice and is also a key focus of upcoming technical assistance efforts. Today's presentation provides an opportunity to learn how one COE is approaching universal supports in practice and creating environments that promote well-being for all students. Next slide, please. And, oh, sorry. If you don't mind going back one slide, we already. All right. So, always been a big fan of Teresa Stevens and the rest of the Riverside COE team. And today they will be sharing examples of their work in professional development, coaching, technical assistance, PBIS, MTSS, and wellness initiatives. Their presentation will highlight how comprehensive systems of support can build capacity across LEAs, strengthen school-based mental health implementation, and help create sustainable conditions for student wellness over time. We are so excited and grateful to have Teresa Stevens, Denise Granger, and Angelica Plasencia from Riverside COE joining us today to share their experiences and lessons learned. And with that, let's welcome Riverside COE.
Thank you, Carissa. Good afternoon, everyone. My name is Teresa Stevens. I'm an administrator here at Riverside County Office of Ed. And our little unit is called the School Engagement and Wellness Unit. I want to go ahead and just introduce my colleagues, starting out with Denise Granger.
Good afternoon, everybody. Thank you for having us. And we also have
Yes. Good afternoon, everybody. My name is Angelica Plasencia. I'm also a coordinator with the School Engagement and Wellness Unit.
So we have not a very big team. We've grown. We started with a group of 2, and now we are doing not just capacity grant, but we've really tried to weave in all of our work. But just to give you a little snapshot of what Riverside County is all about, and just to give some context, Riverside County Office of Ed, we are the 4th largest county in California. We support approximately 423,000 students. We have 54 LEAs. That includes 23 school districts, and the rest are our charter schools. We are a very geographically large and highly diverse county office serving urban, suburban, rural, and mountain communities. So as you can see in the map there below, we are widespread. So geography is somewhat of a challenge for us to be able to reach all of our LEAs. About 65% of our students qualify for free or reduced price meals, and 23 are English learners. And really the foundation of our work is what we call the Riverside County Collaborative, or RCWC. And this was developed from our Riverside County Office of Superintendent Dr. Edwin Gomez as part of his mental health initiative. And the goal of RCWC, and you'll see that kind of all throughout our slides, is to just bring that education, healthcare, behavioral health with our community partners, so together we can build that coordinated system of support for our students and families in Riverside County. So this is a structure that continues to guide our work today. Next slide. I wanted to just take a minute to talk about how we were able to build our tiered system of support, including that Tier 1 universal supports for all of our LEAs. So this is a timeline over several years of our intentional work by our team in collaboration with some grant partners and community partners to help build our systems and infrastructures with our districts to support whole student wellness. So we started by helping LEAs strengthen their capacity to support all 3 tiers. And we really use the MTSS framework with a strong focus on Tier 1. So I don't know how many county offices are part of SBHIP. So we had that kind of to start off our mental health and wellness unit with our SBHIP and CalHope in 2022. We supported our districts that are part of those 2 grants in expanding care coordination. We had implementation of SEL and strengthening wellness supports for both students and adults. Then throughout our SBMH and MHSP grants, those were federal grants. We continue to work with our LEAs who are part of those grants to expand school-based mental health services, to develop those wellness centers, partnerships, and increase the workforce pathway for all of our schools. And I wanted to kind of go over a little bit of this history because I believe that these are some of the grants that helped us in positioning our LEAs to participate in the CYBHI fee schedule program. So as a result of the work that happened even before CYBHI, we had a lot of those infrastructures that were built into our LEAs that really leverage them to be able to participate in the first 3 cohorts and be able to do some billing that's eligible for Tier 1 services. So currently we have 41 LEAs who are part of the capacity grant. 28 are and growing are part of a cohort for CYBHI fee schedule. Next slide. So collectively, these grants served tens of thousands of students that were Riverside County. So over 33,000 students. And we keep track of all of this with our surveys, with all of our LEAs. I'm receiving Tier 1 supports alone through the grants from SBHIP, for Cal Hope, and also for SBMH MHSP grants. We're starting to collect some more data around the capacity grant. And so in the next year or so, we're going to be able to share some of that out as well. Another highlight is more than 25,000 service hours provided by interns across some of those grants that we talked about previously. These internship partnerships also, as part of these grants, help increase the workforce capacity, and it expanded the access to services for all of our students and families that were not there before. And with that, our districts are having interns become certified wellness coaches and teaching them about CYBHI fee schedule. So when they actually get hired as permanent staff, they're able to continue with the billing for CYBHI. Many of our participating LEAs were prepared to begin billing cohort 1 because of all of that work that happened previously, like I said before. I did want to highlight some of our LEAs. Palm Springs Unified, Harupa Unified, and our RCOE Alt Ed unit have billed more than 200,000 through CYBHI each, and are projected to exceed about 300,000 in claims by the end of this school year. So overall, with all of our LEAs that have started billing this year, we are close to $1 million in total reimbursement just in Riverside County, and it's growing. We have such great relationships with them that they tell us every single time they reach a milestone and how much they have billed and how much they have claims that are still waiting to get reimbursement for. So just really grateful for these cohort 1 early adopters. They have served as our model districts to support other districts in really being able to see what this could be and as part of their sustainability plan. So just a little information about kind of where we are and how we're supporting Tier 1 with previous efforts before CYBHI and now with CYBHI. And I will go ahead and pass it on now to Angelica.
Awesome. Thank you, Teresa. So we also wanted to take some time to highlight some of the ways that we supported our Tier 1 implementation across Riverside County through professional development and through technical assistance, right? So on the next slide, we want to share some of the trainings offerings that we provide to our LEAs. We have topics varying from MTSS to trauma-informed, grief and loss, right? You could see, and you do have access to the slide deck. I know Denise put it in the chat. So you're more than welcome to open up the PD menu and take a look at some of the offerings that we've had for our LEAs. But what's really important is that no matter the topic, we're really always connecting it back to Tier 1 universal supports. So even in a training like grief and loss, that could be a lot more one-on-one or clinical per se, we do try to make sure that we discuss strategies that are going to help school staff, educators, really create supportive environments for students. And so not just for those that are experiencing a specific challenge, right? So we focus on making sure that there's normalizing conversations around emotions, of fostering connection and belonging. So another example is like the art and play interventions, right? We also make sure that we cover interventions that could be pushed into the classroom and can be done with everyone when it comes to Tier 1. And we know that sometimes professional development or training isn't enough. And so we make sure that we are providing ongoing support through coaching, office hours, and other types of outreach to our LEAs. One of the ways that we have been reaching out and sharing information is through our newsletter. So our newsletter is newer and we're pushing that out about quarterly. And so through this newsletter, we're highlighting all the great work that's happening in the LEAs. So we always, like Teresa said, encourage them to share their milestones or successes. And then we share them out with everybody else because that's a great way to share ideas, information, right? And just stay connected and build that community within Riverside County. So again, that is linked on the slide deck. So we highly encourage you to take a look at what we have there. But then on the next slide, we do, aside from offering these professional developments, we also put a lot of thought into how these professional development trainings are offered. And so we know that when adults are able to experience the practices that we want them or encourage them to bring into their campuses, it's best for them to practice themselves, right? And so with that in mind, we do structure all of our professional developments with the CASEL's 3 signature SEL practices, right? The inclusive welcome, engaging strategies, and intentional close. And so, like you could see on this slide on the top left corner, we have one of the interns that Teresa mentioned that volunteered to run our welcoming activity that day. And so usually we reach out to the district or when we see them in person, we ask them to volunteer to run one of those. And there's always somebody more than willing to do so. So again, a lot of engagement, as you could see. Here are some pictures of the art activities that we do, the movement. On this slide, you also see a picture of a kit in the middle. So through the grants, we have had the opportunity to provide to the districts, to the LEAs, implementation kits or materials, right? And so that on there is a picture of wellness kits that were shared for their wellness spaces and wellness centers. Again, a lot of resources that we're able to provide through the grants when possible. And then one of the other tools that we like to share, and it's linked on this slide, is the professional development training. And that's ready to go, right? So they're able to make a copy of that and share it in whatever way they feel is necessary. We've had districts that have shared it with their parents, done presentations on trauma-informed trainings and whatnot. So again, just wanted to highlight some of those things, and they are linked in the slide deck for you to further explore.
Okay, so when we go to the next slide, we just wanted to highlight, I think what one of the strengths of our team is that we have brought together both folks with clinical support, so like Christina on Helica, who have both the school-based clinical support or expertise, and then those of us like myself who come from a more teacher and school administrator background, so with the PBIS and SEL background. And I think the strength of our team then is that we are able to collaborate together in support of our schools, especially with what Angelica and Teresa both emphasized at Tier 1 levels. So we particularly offer quite a bit of support having to do with PBIS. So that has to do with both professional development and ongoing coaching. And now that we know all of our districts that are included in Capacity Grant, we're able to, during those coaching sessions and when we speak with district leaders, we can help them be more aware of and strategic with building PBIS and SEL support in with Capacity Grant money or dollars or funding supports. So we're helping them to see the connections to all of that work. So then on the next slide, you can also see one of our big emphases, as I said before, which is not just training sessions and schools that are participating with us in professional development, but really coaching. That's where the real work happens because we're helping them on an ongoing basis. And this is, again, also helpful for our schools that are participating in the Capacity Grant and districts because we can help them make those Tier 1 universal connections. One other quick shout out on the next slide is we are also connected with SEL for California and their Thriving School Awards, and 3 schools here in Riverside County received the pilot version of the Thriving School Award last year in 2025. So again, that, and actually 2 of those, actually all 3 of those schools are in districts who did Cal Hope work with us. So also in connection with SEL backgrounds, and they are also heavily invested in the Capacity Grant work. So we're really, again, helping our districts make lots and lots of connections. So Teresa, I'd like to pass that on to you to finish us out.
All right, thanks. So on the next slide, you'll see how we have our own internal MTSS committee here at RCOE. 25 active participants from all of our divisions, ed services, early childhood, we have alt ed, data. All of them are part of this whole committee. And so we are providing professional development to all of our LEAs around MTSS, weaving in PBIS, weaving in mental health, and all the work that we're doing through the capacity grant. And on the next slide, we celebrate all of this work at the end of the year with our SEL conference. About 300 participants who come. A lot of our presenters are actual LEAs and districts and school sites that present what they're doing. So just a great way to celebrate. We use a lot of the ideas that we get from them. We put it as part of this SEL conference. And then just to kind of close this off, just how we are looking into the future on this next slide. You'll see that Tier 1 is continuously something that we focus on in all of what we do and how we support TA and also coaching and our professional development. So these are those buckets. And with everything, our last slide is just like, here's our wish list for the upcoming year of what we want to do. That we know that I think Sac County shared something around SWAT, which is a student wellness committee, and we really want to be able to do that as well. So that's on our list. We are going to be doing a quarterly community of practice. We're going to continue to move all of our professional development in different areas, more in the desert, so multiple places, so there's more access. And then we wanted to develop a wellness program for adults in school, partnering with Kaiser Permanente. And then just kind of developing a countrywide recognition system to support and recognize and highlight the great work that's happening in Riverside County. So thank you so much for listening and having us share what we do at Riverside County. A lot of it is what we got from all of you as well, and we're hoping to continue to grow in what we're doing. And I will pass it back to Carissa.
Thank you so much, Teresa. Such a wonderful presentation from our Riverside colleagues. And now I invite folks to hop back into their breakout rooms. And these are our discussion questions. What promising practices did you hear from Riverside? How are Tier 1 supports showing up in your own LEAs? And what supports would be helpful moving forward? Our colleagues will open the rooms. See you there. I see folks are trickling back in. Thank you so much. Our group had a really quick conversation, but it was such rich conversation as well. So I hope you enjoyed your discussions. And now I will turn it over to, no, I will take us to our break, a much needed break actually. So we have a 5-minute break. And please enjoy a song picked out by Najwa from St. Levant called Calamantina. Enjoy your break.
Hi, welcome back from your break. We hope you enjoyed the music. That was some great music. I really enjoyed that. If we can go to the next slide. Perfect, thank you. For our final spotlight, we are very excited to showcase the incredible work of Yolo County Office of Ed and their partnership with community-based organizations to expand behavioral health supports through youth voice and culturally affirming practices. In a county with many small and rural districts, this work is making a real difference, ensuring supports are equitable, responsive, and shaped directly by the voices of young people. You'll hear a powerful example of a CBO that designed its interventions through authentic youth engagement. We are thrilled for you to learn from this work. So without further ado, I will pass it over to Najwa Burdik Yaya from Yolo County Office of Education.
Hello, everyone. Thank you so much. And I apologize if I have to clear my throat a few times. We had a fire locally. Everything's fine, but the smoke definitely did not help. And sorry. again, I'm the manager of professional wellness over here at Yolo County. I help support a lot of our CYBHI initiatives, including our capacity grant and fee schedule scaling, and provide technical support to our LEAs. I also oversee our wellness coaches. And so I have gotten to dive deep into a lot of this work, and I'm excited to share a lot of this with you. Um, and my background previously actually was from one of our LEAs. So this was my first year coming into the county office, and getting to see the work from this broader lens. So if you don't mind going to the next slide. So just to set the landscape of who we are, Yolo County is roughly about 221,000 residents. Um, the data we collected this from is a little bit older, so it might be slightly different. Um, and about 30,000 of that makes up our student population, not covering TK or our early childhood programs. About 16.6% of those children live in poverty currently. Our demographics is primarily a mix of um, Hispanic and Latino populations, as well as Asian Pacific Islander, um, and primarily white. And really, that develops, or the expansion of that depends on the district area. And we're pretty unique in that we have rural districts, we have suburban districts, and we have a district that is pretty urban as well. So a lot of that varies in the differences in the diversity of those populations. Um, and you can see a little bit of that in the bottom right-hand corner. For example, Esparta Unified is very rural. We have a lot of migrant populations living there, and it's about 54% Hispanic or Latino. Winters is about 70% Hispanic or Latino population, and Davis has about 24%. So there is a lot of work we have to ensure that we're doing in terms of cultural competency, inclusive practices, and again, culturally affirming practices, and how we work with our community resources to ensure that everyone's receiving the services they need. And that includes that it's accessible in the languages that they need as well. Next slide, please. Um, and why this work matters. So in our county, we have actually been collaborating with various organizations and government agencies in our county to work on what we call the roadmap to the future. And in that, a needs assessment was conducted to see what really are the needs of our county and our families and our communities. And how do we address those in a way that we are setting up our families in the future to have where being born in Yolo County is really an advantage, right? And really sets everyone up for success regardless of their background. And so specifically to our work, need number two was a countywide need that was identified related to expanding access to mental health resources. And in that, we talk about what we call the K-12 school partnership, which is a partnership between ourselves, our LEAs, our health and human services, as well as our community-based organizations. And that really be developed from a lot of these needs that were identified through the roadmap to the future needs assessment. Next slide, please. So what is our K-12 partnership? It's a cross-sector planning and coordination structure. Really what we do is we plan for funding priorities, we coordinate service delivery, we track collective impact on student mental and behavioral health. And the foundation is really what I think makes a lot of this possible. It's really reminiscent of the roadmap to the future and a lot of other functionalities or ways that we function as organizations, in that we are stronger together rather than working independently in silos. So again, the partners at the table include our LEAs, our county behavioral health teams, in our community-based organizations. And the partnership is how we, as a county office, kind of operationalize a lot of the roadmap's mission regarding behavioral health, and coordinating those community assets and uplifting what we currently have, and maybe how we can add more to that and what is out there based on the strengths or the connections that we have in our organizations. Next slide, please. And really that partnership was born through just as a lot of other partnerships or initiatives we've heard through our MHSA and MHSSA funding. So initially, this was established as a way to sort of fiscally manage the funding, enter as a consortium, really work together to maximize the opportunity that was obtained through these funding sources. So through that, we were able to place mental health clinicians at every school site. Some were funded through these specific funding sources. And then as our district saw the advantage of this, they actually began also funding some clinicians from those community-based organizations themselves. So it's really equity focused. This way, our smaller and rural districts were able to gain access to supports where our districts maybe can't always afford to have their own mental health clinicians on staff, and it reduced barriers to care for students who had fewer options. So rather than having to travel long distances to gain this access, these services were being provided to them in schools, and really integrating in the school systems. And I can speak from experience. I work collaboratively with our community-based organization and the mental health clinicians that were at my sites. And coordinating in our cost teams, our SSTs, they were really part of our school system, and engaging in that work. And a work in progress now is the question on everyone's minds with the shifts in BHSA and the focus on sustainability. We're actively working on how we can continue to braid this new funding with existing and potential resources, navigating how we can implement the fee schedule and billing restrictions with our CBOs, how they can help support with that, either through affiliated or embedded services. And they are actually also, in some cases, onboarding to our county EHR, which some of our LEAs are using, alongside eligible district providers. So in that learning, we are all doing that together. They are sitting side by side together and working on this model and the sustainability as one entity rather than really acting as individual organizations. And sustainability is definitely a work that is central to our roadmap long-term vision for these services. Next slide, please. So an example of some of the work that our CBOs have done, RISE is our CBO that works with our rural districts, specifically Winters and Sparto. So they have organized the past couple of years what they call EYC, so Elevate Youth California, and have worked closely with our middle schoolers at those districts to develop the agenda and the topics that were being shared. And it was also conducted by the students. So you can see in the difference, what came up for each of the sites was really informed by what the students were seeing with their peers and in their communities. Winters Middle School selected a topic on vaping, whereas Esparto Middle School's topic centered on bullying. So these were what came up as needs for them as youth, and really highlighted the impact of the voice when we give students the platform to do so. And again, it ensured that the topics pertain to their needs, rather than just having a blanket curriculum that was being shared across. Next slide, please. And so in building our culturally affirming systems, and everything we're building, whether it's our referral forms, our student information systems, including our electronic health record with the fee schedule, we're doing our best to ensure we're including inclusive options, like gender identity, expanding demographic options. Um, I know myself as a high schooler, I never had a box to check, and that was really difficult for me, like taking AP tests. So, speaking from experience, wanting to ensure that all our students feel seen. Again, our CBO providers are participating on-site team meetings, not as guests, but at partners in the table to ensure that students are being supported. And then in our coaching of our wellness coaches, we're ensuring that they have that knowledge around culturally affirming practices, and that their work really reinforces and exemplifies safety and belonging for all students. Next slide, please. So again, this helps create generalization across our systems. Our CBO partners consistently attend professional developments and professional learnings, including a learning series we developed to focus on onboarding for the fee schedule and providing culturally affirming services to our students in our communities, which just really helps expand this countywide rather than, again, maybe one LEA thriving and the others feeling like they're not being supported. We have that expansion along district professionals as well as our CBO partners. Next slide. Thank you. Sorry for rushing, but so what we're learning, again, youth voice is structural, it's not supplemental. They have a lot to say, and we need to uplift that and let that inform the work and our priorities as well. Culturally affirming practices lives in the details. You know, our nameplates having our preferred pronouns, that inclusion in a referral form or a sign up form, a Google form, really in all the little places. And then our cross-sector partnerships can be complicated, but building out those relationships is invaluable and essential to the generalization of practices, but also the fidelity of implementing those practices and the consistency of those practices, which really builds up, again, kind of going back to our youth voice, but that confidence and that safety and belonging for our students to be able to be welcome to participate and share their voice. And then the sustainability is the open question we're all working through together. But we're naming that, and that's something we're actively working on. And having these community of practices and partnerships that we get to build are really helpful in having that thought partnership as we think about this statewide. So thank you all so much. I appreciate the time. And I hope I did that justice. Thank you.
Thank you, Najwa, for sharing all of that information with us. It's so great to see how youth voice is being leveraged in this work that really is for them and should be designed with them. So thank you. If we could go into the next slide, we are going to go into our final breakout room of the day. And your discussion questions, which thank you, Sienna, for popping those into the chat, are how are youth informing your work where you are? What does culturally affirming practice look like in action? And what is one idea you want to take back to your team from today's presentation? So with that, we're going to go into our breakout.
Right, welcome back. I hope everybody had a good time reflecting on the youth voice and culturally affirming practices presentation from Najwa. Najwa, thank you so much. I keep pulling up your final slide and just reflecting on the key takeaways that you have there that really resonate regardless of what level you're working at. Next slide. So what we're going to move into now is just a Q&A and collective reflection with our presenters. So I think we can take the slides down for this portion, Drusilla, and welcome anyone who had reflections in your breakout rooms or questions for the presenters, you can go ahead and come off mute and ask them if you have questions, or if you're just like, wow, that part of that slide really stuck out to me, and you want to share a little bit about why that is. We welcome those reflections as well. Anything coming up for folks? I will kick us off with saying the final slide from Najwa, where it says culturally affirming practices lives in the details. Who's in the room, what the form says, how referrals work. I think we can all say at doing countywide work, there are so many ways, whether it's in the calendar invite, making sure that the information is clear so folks know how to access information. And there's just a million ways we might consider making our work more accessible and more inclusive.
Liz, were her slides in the chat?
Yes, and we'll post them again.
Okay, thank you.
Thanks for sharing that, Liz. We actually talked a little bit about that in our room as well, in that naming that some of these systems we're working with, right, even billing and things like that, weren't necessarily designed for those that we're serving or those that we want to bring to the table in the conversation. And so while it's still important to do those things and to name that, and like you said, even just like on a form or whatever that might look like, it's challenging because those systems weren't designed for that or by people who they serve or with them. So, and it can be really challenging to bring youth into that part of the conversation.
Thanks, Tanya. You're saying it's not easy to work up in state systems and federal systems that...
Yeah, I mean, I'll wave my magic wand, but...
Yeah, it's complex. Any other reflections that are coming up for folks? Anybody else have a local newspaper as cool as the Mariposa Gazette that you're, pushing out this work to? Wow, that's pretty cool. And Desiree said, I really appreciate the intentionality with the cultural appropriateness to meet different needs across various districts and areas. Absolutely. Thanks for sharing.
I have a question for Yolo County. At what age do you guys start engaging the youth? Like that information that you provided where they're giving feedback?
Yeah, so I would say primarily it starts around middle school for, I guess, more of the impactful work that you, or like observable work that you can see. Um, so in certain areas, however, in more of like the intermediate, like third through fifth grade regions, there are leadership, um, like groups or clubs to kind of help start prepping them in that. And so there's a lot of engagement across with either our CBOs or our wellness specialists or wellness coaches, and a lot of that work too. So I would say more traditionally what you would consider engaging the youth and really having them share their voices would probably be around middle school. With sort of those younger grades, it might come through more through like play or engagement, like through other activities. Um, but then they get to see sort of the impact of what they're sharing in those activities too.
Thank you.
Yep.
Thanks, Jessica. Great question. Any last reflections or questions that are coming up for folks? Alejandra from Merced said, I love the conversations we had regarding engaging the youth. It creates transparency and trust in the community, which we could all get more of. Thank you very much for all the great ideas. Thanks for sharing, Alejandra. Agreed. Okay, well, if anyone has any last reflections, feel free to come off mute or share in the chat. And while that happens, Drusilla, if you want to go ahead and pull up the slides for our intentional closure. All right, so our intentional closure, as we close out today's COP, please take a moment to consider any one action you will carry forward from this work. If you want us to support you and cheer you on, or if you just want to share, feel free to do so in the chat. And then my colleague Sienna also put the feedback form in the chat. As you may have noticed, we tried something out that was a little bit different this time, and we'd love to hear your feedback on how it went. So with that, we will just hold space for anyone who wants to share any one action you will carry forward from this work. Tanya is going to continue to leverage youth voice and focus more on cultural responsiveness in spaces. Jeff is going to take a reinforced mindset inspired by YOLO. Cross-sector partnerships are worth the complexity. I feel like that needs I need a t-shirt that says that. You might be the quote in our next newsletter, Najwa. In Tuyi's group, heard there were opportunities to identify creative ideas to engage youth in programming and bring it back to their own departments to consider. Chris says he's thinking about developing youth-led social media campaigns. Very cool. I'll see if there's one last reflection or action. We know we can always count on you for that, Jeff. I love it. And Najwa mentions continue engaging the work and maybe expanding our partnership to include youth representation. Ah, love it, love it. Beautiful stuff. All right, y'all. Well, thank you for a fabulous community of practice. Let's give some love, some hearts, some claps to our three presenters from Mariposa County, from Riverside, and from Yolo, who took us through an end of the year on our three themes this past year from the capacity grants end. And we're really grateful for you sharing your expertise and your stories and your voice, your templates, and continuing the conversation. I hope just maybe one idea or reflection sparked for you today that you might consider following up on or continuing conversation with peers in office hours or other spaces. With that, appreciate y'all, and we'll see you at office hours on Friday. Thanks.